Hopefully. Alrighty, there we go. Good morning, everyone. Welcome to this week's episode of Next Level Play Therapy. And I'm super excited about my guest this week, Dr. Robert Jason Grant, who is the creator of AutPlay. And I was so excited. I ran into Robert at the APT conference in Houston and thought, oh my gosh, I can save myself the email I keep forgetting to send him about coming on the live stream and the podcast, because I get asked all the time in my consultation programs how to work with kids who have neurodivergent systems. Mm-hmm. So as a mom of two neurodivergent kids, and probably I would have been diagnosed as well, I was super excited. Robert said yes. Mm-hmm. So that is what we're going to talk about today, how to support the needs of children who are neurodivergent in play therapy. So Robert is a therapist, a supervisor, consultant, and the creator of AutPlay. And so welcome, Robert, to this week's episode of Next Level Play Therapy. So I don't know if you want to say a little bit more. Yeah, it's great to have you. I don't know if you want to say a little bit more about yourself or.
Well, I'm excited to be here, and I'm glad we ran into each other at the conference. So, yeah, I mean, I think you covered the bases. I'm a registered play therapist supervisor as well, and so play therapy has been kind of a mainstay of my mental health career from the beginning, and then utilizing it in working with neurodivergent kids who have mental health needs has been a big piece of what I put my time into and what I still do in the clinic, seeing clients or out there on the road doing trainings.
Yeah, you've been doing a lot of trainings lately. It's like sometimes I'm like, you know, that show my husband is such a knucklehead. When we were dating, this is like a gazillion years ago. Remember that show? I don't know if you're even old enough to know this show, but there was a show on TV called Where in the World is Carmen Sandiego?
Oh, yes. I remember.
Yeah, right. Yeah. He would, even when we were dating as like young adults, that was his Saturday show.
Yes.
Where in the world is Carmen? So I feel like where in the world is Robert? Like
sometimes I feel like that. Where in the world am I? But it's been, it's been great. I mean, actually, it's super exciting to go to another country and talk about neurodivergence, because there are a lot of places that really, it's still very new idea and not something that is getting implemented a lot, neurodiversity affirming care. And so that's always really fun to get those opportunities. But yeah, sometimes it's like, I just am ready to be home.
Yeah.
Because I'm a homebody. I'm like, I like to just sit at my house and do nothing. So sometimes it's nice to have that.
Yeah. I'm a homebody too. Like I like being home, have my home base, have my people around me, and then go travel from there. Yeah. So I totally get that. Like traveling can be
absolutely
tiring for sure. Yep. Well, let's go ahead. And one of the, we were talking a little bit before I hit the go live button. We were talking a little bit about how to use AutPlay. Not more about like the importance of having a program or have a way of meeting the needs of kids with neurodivergent systems. And that's why I think your program that you've developed, or your model is a better way of saying it, to work with neurodivergent kids, AutPlay, I think, is a really important topic. And we were also talking a little bit, which I would be, okay, so I'm super nerdy, FYI. And like we were talking a little bit about we're always learning more about autism and neurodivergent ways that it shows up in our systems and our ways of being, so to speak. And I was curious, I didn't tell you I was going to do this. So
That's okay. That's all right.
like, oh, poor Robert. He's going to be a good sport, though. And I was curious about some of the things that you're kind of noticing these days or finding out a little bit more from the research about some things that we're learning about autism and neurodivergent kids and teens. That because we're always learning and more things are coming forward about it. And I know people are, you know, hearing different things, some of which may be true and some of them may not be, and not sure what the heck's going on. So I don't know what your thoughts about that are.
Well, I think that I like that throw-in question because actually I think that's kind of what's informed AutPlay's growth through the years is as we have learned better how to help, who we're calling neurodivergent individuals, then AutPlay has adjusted and shifted. It's a framework that, looks really quite a bit different than it did the first time it was created. And that's because of this knowledge that is in. We've learned more about neurodiversity affirming care. And we've learned more about the real needs of neurodivergent kids and adults. And that has shaped, the changes in the AutPlay program and the growth. And I think my growth as a neurodivergent person, because these concepts were, really first came into existence in the very late 90s and early 2000s. So they've been around a while, but they weren't really known then, even though that's kind of when they emerged. I would say it's been over the last decade, 15 years that this has really come into more mainstream knowledge, the things that we're talking about. So there's a lot of people out there who have been discovering neurodivergence, discovering what it means to be talking about the neurodiversity paradigm and being neurodiversity affirming. And then that has increased the research, which has been helpful. And I think that's just going to continue to happen more and more. I think one of the big things for us in mental health care with neurodivergent clients is our understanding of identity awareness as a very positive mental health concept that almost in the AutPlay framework, it's an all the time goal. Is that the child is going to learn, how they operate, who they are as an autistic child or an ADHD or someone with sensory differences. And it's going to be presented to them in an affirming way, not a problematic, pathologizing way. So it actually directly relates to their self-worth. So that becomes a huge mental health piece.
Agree. Can I tell you something? You're going to be appalled by this. I'm kind of like, I look back on it and I think, oh my gosh. So I got started in special education as a special education teacher back in the 1980s. And they still use this classification, which I find appalling, which is children with SED, severely emotionally disturbed.
Okay.
It's such a horrible time. And they've had it for years. That's the one back in the 80s. That was the special education focus that I had. And so when I started as a special education teacher, smack out of my bachelor's degree in the 1980s, I don't know if you know this question. Do you know what they called kids, which now they call it attention deficit hyperactivity
Mm-hmm.
disorder, right?
Yeah.
This is kind of a pop quiz. Do you know what they called it back in the 80s?
So do I know what they called ADHD back
Yeah,
in the
back in
80s?
the night, it's an appalling term.
I
They
don't know. I don't know.
called it minimal brain dysfunction.
Oh my gosh. I'm not surprised it was something that sounds
Yeah,
degrading.
minimal brain dysfunction.
Yeah,
And
that's awful.
I remember, thank goodness, I don't know. I think they changed it with when I went back to grad school, and I was getting my degree. We were using the DSM 3R, and in
Right.
the 3R it had been changed, so that's good.
Oh my gosh,
Back in
thank
the
goodness.
early 90s, right?
We have come up with some pretty
Atrocious.
dehumanizing terms for
Oh,
different
yeah.
diagnosis in the DSM, that's for sure.
Yes,
Yeah.
but I remember it. I remember back. When was it? It was in the early 2000s. Like nobody was even talking about sensory
Yeah.
issue. That's how I found out about it. My kids had it, and I'm like, why is my kid not working the way other kids do?
Yeah.
And I get all of this advice from the other moms, and then I'm a new mom, and mom like, I tried that with my kid, and I'm not doing it anymore. So give me your looks. I don't care. Like that just the model kid I got does not work that way. And
Yes.
what I realized much, much, much later was the sensory issues, and then much, much later that it was ADHD.
Mhm.
But this was back in the early 90s. There was no mental health coverage for autism.
Right.
And all the services for kids with autism, parents had to pay out of pocket.
Yeah.
And so things have, I think, moved in a really good direction compared to
Definitely
where
improved.
I think.
Yeah.
Yeah.
I think we have that going in our favor, that things are improving now at
Yeah.
a regular rate. There's a lot of things that still need to improve, but it's on the road. you know,
Yeah.
at least people are looking at it and understanding it and learning more, and then systems are changing and processes are changing. So we're in process, which is good.
Yeah. And so how would you describe AutPlay, and what is AutPlay? I don't know, Robert, if you notice my little fancy banners here.
I like them. Yes, I did notice.
Stream
Oh,
has these cool little banners. Those of you listening to the podcast, you won't be able to see my fancy little banners. But if you're watching on
if they
YouTube,
look good, we'll just tell you they look good. I think AutPlay, well, first of all, it's a framework,
mhm.
really not technically a model or a theory. It's thought of more as like a framework for understanding how to do neurodiversity affirming care,
Okay.
with a special focus on play therapy, because that's what I am, as a play therapist, and what I primarily do. Although I think a lot of the neurodiversity framework components would apply to anybody who's working with neurodivergent kids, even if you're not doing specifically a play therapy theory or approach. But it's a way to understand neurodivergent clients and what is meant by being neurodiversity affirming or applying neurodiversity affirming care when you're working on your therapy goals with this client. We're really trying to avoid ableist pieces in our mental health work. And so it's sort of like a layover. Like I can go out and do Gestalt play therapy or Adlerian play therapy or child-centered play therapy, and then my alt play therapy training comes in and informs me about
Okay.
how to stay neurodiversity affirming throughout that process if there's a neurodivergent child that I'm working with.
Oh, that's awesome. Okay. Oh, okay. Well, I'm glad you said that, because I've been saying so I have a play therapy academy program, and we do consultation
Mhm.
a month. And people in the program, they ask all the time. And so my way I've been describing it has been, because I took your training. You came to Nevada that one time, and
Yes.
we had
I remember that.
we met. We
Yeah.
had that, which was really good. And as I was taking the training, I was thinking, this is a lot like an improved version of child-centered play therapy for kids who are neurodivergent.
Yeah.
And so it's kind of the way I've been explaining it.
Yeah.
The next thing out of my mouth is usually, have you heard of Robert Jason Graham? AutPlay. You should probably take that training if you have a lot of kids on your caseload. Yeah.
Yeah. Well, I appreciate the shout outs. I think
Yeah.
it's such a great training because it probably has more philosophically in
Mm.
line with the cultural humility training than a
Oh,
play therapy theory training, if that makes sense.
it
Because
does make sense.
we are talking about diversity and, a group of people who are recognized as a diversity group. And so there's a lot of those components in there. We do have a piece, and I think this is kind of what you were talking about. It's called the Follow Me approach, which we did put together, which is probably the most model-like component.
Mm-hmm.
And it has a lot of child-centered play therapy and filial therapy integration. But it was put together specifically for high support needs kids. Because,
Oh,
of course, when we say neurodivergent, we're talking about people all over the spectrum of presentation, from
right.
somebody who's a member of Congress to somebody who can't leave their home without 24-hour care. And so that's a pretty incredible range of
Yeah.
people sharing the same diagnosis sometimes and sharing the same identity of neurodivergence. So with kids who are in that category of really high support needs, they may not engage, they may not speak, they may present in ways as being very withdrawn, or have a lot of co-occurring, maybe medical conditions. They come into the playroom sometimes and they're just not going to play like the way a lot of play therapists are going to be used to
Mm-hmm.
seeing. And so the Follow Me approach is just a guide for how to work with those kids in mental health care. And it's very humanistic based.
Mm-hmm.
So there's a lot of CCPT and filio in there.
Yeah. Yeah. You know what? I think you're right, that because when you were talking, I was thinking, yeah, that's the part that I do remember. Yeah. So how would you say play, if you're a play therapist, how would you say play can be helpful to add to, for lack of a better way of saying it, your therapeutic toolbox? And I love that idea of diversity. I think I've kind of thought of it that way as well myself, but nobody other than, well, nobody said it outside their heads in my presence. So yeah, and I haven't said it outside my head.
Sure, that's okay. I love this question, by the way.
Yeah.
Such a good question. I think that in two ways. There's the standard, any child who comes in to see us, I mean, there's a mental health need or we're not going to work with them. So it's trauma, it's attachment, it's depression, it's anxiety, it's whatever is going on that we need to work on. And I think what the AutPlay framework does in those cases is it comes in and really helps the practitioner understand, I may be working on trauma, which is the therapy goal. And maybe I'm going to use some play-based EMDR. Maybe I'm going to use trauma play or whatever. But the AutPlay framework comes in and helps them understand this is a neurodivergent client. So they may need me to do this in a different way that best fits the way that they process, communicate, experience emotions. So it helps with the idea of what we kind of always say in the framework is we take our play therapy theory to the neurodivergent child. We don't force our neurodivergent child into a theory.
Oh, I love that.
And
Yeah.
that kind of helps people understand how to do that when they're working on those goals. The other way it helps children heal is, and this is the piece that the research is really emphasizing now in a really nice way, is neurodivergent kids have certain needs to really put them in a good mental health space. And they're specific to being neurodivergent. So you may be working on some of these things as your therapy goes, like identity awareness from affirming perspective, autonomy, advocacy, self-worth. These are all things that can take a hit by being neurodivergent and navigating in neurotypical systems that aren't supporting you. So that becomes a whole nother side of the therapy that we might be working on with the child and helping them with.
Yeah, I love that. And as you were talking, I was, because it's interesting because as play therapists, we're therapists, right? We help children. We usually have our own kids, and so sometimes there's that overlap between, okay, I'm wearing my play therapist hat, I'm wearing my mom hat.
Yes.
The two overlap, so I can take my play therapist hat and figure out how to support my kid. But I remember when like my son's almost 30, the oldest one. And there wasn't a lot back then. I mean, I knew a lot just because like I could probably chase it through the down my family system, some things. Yeah. But I remember it takes a hit on their self-esteem because I can remember just some of the struggles that we had, and I'm watching his little self-esteem. Well, both of them actually in different ways. And I think play therapy is a way to be able to help children see themselves in a better way. Like you were saying, identity formation, and I'm not bad.
Right.
I'm this positive thing, or I'm this positive thing. And
yeah.
I'm a cool kid.
Yeah, it's interesting because both these terms, neurodiversity and neurodivergent, they came into existence as socio-political terms. That's why they were created. That's why the people who created them, and that's how they defined them. And the point, being of that is they were adults who were autistic, ADHDers, and they were saying, hey, yeah, we do have needs at sometimes, that maybe a need for this service or that service or therapy, but there are things that are just who we are, that are differences that aren't a need, but they're being pathologized. And we're being put in therapies to address things that aren't a deficit, they're just a difference.
Right.
And that's really where that socio-political idea came from, of those terms. And it kind of goes to what you were saying when you navigate through, as a kid especially, you're walking into different environment after environment, and the message that you're getting when you're just kind of being you, how your brain works, is that it's bad and you're a problem. I mean, it's going to take a hit to the self-esteem big time. And then we know that starts the bad road to all kinds of mental health issues when.
And I remember that back when I was a special ed teacher, because back in the 80s, at least where I was, we were living in Virginia, in Fairfax, and I was teaching in Fairfax County, right outside Washington, D.C., which is like a ginormous school county. But I used to break my heart as a teacher, kids in there. Like I can remember a couple of kids, super bright. Like you could tell their brain was so advanced, and yet could not read.
Yeah.
Like could do the comprehension piece, but not the I don't know what the word is. I'll say it, decoding piece. Like I couldn't I couldn't break down the mechanics of the word at the same time, and just broke, like saying things like I'm dumb or I'm stupid, and
Right.
and just saying to him, oh, you're not really, but like if I read this to you, you get it like
Yeah.
faster than the other kids. I had
Yeah.
to say that quietly.
Right.
So just trying different strategies, but
Mm.
yeah, we've come a long way.
It's nice.
And yeah, in some ways, still not necessarily understanding it, like you were saying, in terms
Yeah.
of how are we viewing people.
Yeah, I think systems change is always hard. It
Yeah,
takes a while. It's like, you know, moving a giant mountain around, with some of these systems, but it's getting there. I
yeah,
think on the individual level, for sure, more and more, just therapists or educators are
yeah.
getting access to, like, neurodiversity affirming
And I
information.
think we're more aware now. Like we're
Yeah.
more aware of what I remember back in when was it? When my kids were born in the 90s. So like in the early 2000s, just talking to anybody and anybody about sensory
Yeah.
processing, and hey,
Yes,
you're
yes.
saying, and like, pay attention to this. It might not be that your child is trying to be oppositional. It might be that
Right.
sensory system is just overloaded and we need to do some things differently. And I feel like now people understand sensory issues. I think if we consider asynchronous development, we could consider the gifted brain, and how,
Oh, sure.
you
Yeah.
know, I feel like we still have a lot more work having a gifted kid, um, and a husband who I'm convinced is gifted,
Uh-huh.
although he denies it. But like, no, your brain works different than the average bear.
Right.
Um, so yeah, and so it's good that there are a lot of changes that over, since at least since I've been around in the 1980s.
Yeah.
Like you were saying, I think as we learn more and as the adults learn more,
Yes.
and those who can be the change makers as they learn more, then we got the ability to move things forward. And I think as play therapists, what I've appreciated, what AutPlay brings to our play therapy space, is how do we do that as play therapists? Like,
Mhm.
how do we make sure we're supporting kids? Because we're probably going to be seeing them because they might be coming in for something else. And then as
Right.
therapists, I feel like we realize, something's a little different here. Let's figure out
Yes.
what this is.
I think I have taught, trained, spoken to a lot of different groups of professionals over the years.
Mm-hmm.
Something that I wasn't really planning on happening. But I think because of the topic, I find myself in front of other disciplines or in schools with educators or lots of different people. And I will say that I think play therapists, in general, get neurodiversity affirming care. Like when they hear it, they're like, I get that. And that sounds right. And I want to do that. Because I think just in play therapy in general, and there is this baseline across all of our theories and approaches, which is we want to be child centered,
Mm-hmm.
right? And we want to build up the child their self and those humanistic pieces that really go through all our theories and approaches to on some
Mm-hmm.
level. I think when play therapists, learn that and have that, and many of them do, then this is sort of just like an extension of that in a way. Like it's fine tuning it a little bit more for neurodivergent kids. And
Mm-hmm.
so I find that a lot of play therapists respond, pretty positively to alt play therapy, and also pick it up sometimes after a training. I'll have therapists come up to me and say, this is kind of what I was thinking instinctually that I should be doing with my kids. And now I just needed that validation that I was right. And I'm like, yeah, because, you're a play therapist and, we just have, the child is the important person for us in the room, not our agenda. And I think that that lends itself really well to neurodiversity affirming care.
Yeah. Well, how do you, from an AutPlay perspective, and as a play therapist, what are some ways that you got, like, your framework integrates parents? Because I'm a big proponent of kids live in systems,
Mm-hmm.
and expecting we teach a 7-year-old coping skills and think they're going to be able to do that when they're at a 911 in their
Right.
brain, by themselves. Did you use your coping skills?
Right.
No, I'm 7. I need you to help me.
That's right. All the time. Well, I also am a big proponent of working with caregivers. From the beginning of my career, it has been that way. I just logically went into play therapy thinking I'd be working with parents all the time. I didn't realize, there would be these spaces where you wouldn't work with parents. I just thought, they're in there all the time because why wouldn't they be? And so in the AutPlay framework, we encourage that a lot. We talk a lot about working with caregivers. There's different levels, of course, how that can look depending on what the therapy needs are. But I think it's important anytime. But with neurodivergent kids, we also have to remember there's a lot of other things going on. And
yes,
the parents have to be these frontline people all the time, whether it's advocacy work, understanding how their child operates and being able to explain that to somebody else, accessing services. They are a support service themselves. There's so many components where it just seems odd if we wouldn't be working with the caregivers.
Yeah, I agree. And I think like balancing it out as well, understanding that caregivers are probably going to a bunch of different appointments, and possibly, like, what are, from a service standpoint, what are they?
Yeah.
Are they going to occupational therapy also? Are they doing speech therapy? Sometimes those services are in place as well as counseling.
Yes.
So it can be a little overwhelming sometimes. Yeah. So I feel like as play therapists, our job is to support the caregivers as much as it is to support the kids. I mean, we do that in little different ways.
Well, there's a direct benefit, right? Yeah, whatever you may be a part of doing that's helping the caregiver, you are then helping the child. And so I think when we look at it from that perspective, then we start to open it up more to, okay, how am I going to work with the caregiver with this case? What needs to happen here?
Yes.
And making sure that does take place and that does happen.
Yeah.
And I think caregivers most of the time really appreciate that. They're very thankful for the therapist including them in whatever way it is and helping them with things or providing them with tools. That is something most parents, I think, want. And so when we do that, I think they are also much happier with the therapeutic experience.
Agreed. And just like somebody who gets it and they don't have to explain something to them.
Yes.
Yeah. Way, way, way back in the day when I was living in Virginia, I ran a parenting group for kids, parents of kids who either had ADHD or autism or both, and it took forever to get them in there. But one of the things that I used to say to them is, like, who's going to get it better than other parents, right? Like this, and this is probably 15 years ago now. And they, they'd be like, I don't really want to spill my, stuff in front of people I don't know. But once they got in there and they started feeling like they got the support. They didn't have to explain. They got people who understood, family members who were like, maybe we don't bring your child, or getting judged, like you're not doing a good parenting job, or you should do it this way. You're spoiling your kid, all the things, right?
Right. Excuse me. I'm sorry.
I know we both have colds.
We do.
Yes, yes.
I have been so excited that I got this far without a cold.
I know you were doing good. I was thinking, oh, having a cold gives Robert a really good broadcaster voice.
Oh my gosh, it does. But then
good voice.
I almost got to the whole end without.
I know you did. You were doing good.
I apologize to everybody listening.
No worries. Yeah. Well, Robert, if people want to learn more about AutPlay or some trainings, I'm going to put the website up here. It's autplaytherapy.com. That's AutPlayTherapy for those of you listening on the podcast. But so are there other ways to get in touch with you if people want to learn more, or maybe take some training with you?
Sure. Yeah, I think this website is the best. My email's on there, our social media is on there. All the trainings are listed on there. So going to the website is kind of like a good one-stop.
Oh, good. Okay. And you do consultation as well, or just training if people are interested in doing some consulting with you? Because where I think it gets pretty complex for play therapists is, like you mentioned before, like the layers of maybe trauma or attachment issues, maybe some foster care, adoption, things are working through on top of the neurodivergent things.
Absolutely. Yeah. So supervision, consultation. And again, on the AutPlay website, anyone will be able to find all that information. And even if they just, have a question, they can email us.
Oh, good. Okay. Awesome. Well, I wish we had more time. I'm thinking, I could totally nerd out with Robert. We could probably go on for hours.
We could, I'm sure. Yeah.
Well, thank you so much for joining us today and being part of it and sharing. I know I actually learned some more things as well, so that was super helpful. I don't know about anybody else, but I got a lot out of it.
Well, I had a good time. So thanks for inviting me.
Yeah. All righty. Well, for those of you who are watching live or watching the replay, we'll also post in the comments links to the website. And other than that, and then next week, the next 2 weeks off for the holidays, I'm going to be taking a break from the live stream episodes, but I'll be posting some of the replays of previous. I call them oldies but goodies. So I wish you a happy holiday season, Robert, and the rest of you watching live or listening. Happy holidays, everyone.
Yes. Take care.
Bye.